everybody. My name is Jesselyn Martin, and I'm an account manager with Shoebox. I'm here today with Dr. Madonna Blair, an audiologist of Princeton, West Virginia, that's recently opened a clinic called New Hope Hearing Solutions. Thanks for joining us today, Dr. Blair.
Thank you.
Great. So can you tell us a little bit or share a little bit of background information about New Hope Hearing Solutions?
Yeah, New Hope Hearing Solutions is our new private practice in Princeton, West Virginia, the southern part of West Virginia in the beautiful mountains. And this is a dream that my husband and I shared. I had been home with my children for several years and was ready to get back to the workforce and wanted to open my own practice. So we are super excited. We opened this summer, 2021. A little bit about this area. It is a small rural community, but this town is housing the primary medical facilities. So we serve many of the rural areas and the outreach into the rural communities that surround this. I have about 20 years of experience in the field, mostly working with ENT practices. So it's been so exciting to be able to do what we're doing here, is taking everything I've learned over the years and making it our own.
That sounds like a great background story, and I'm glad that you were finally able to fulfill that dream that you and your husband have had for so long. And can you tell us a little bit about the challenges you were facing, and how did the Shoebox solution help New Hope Hearing Solutions overcome that challenge?
Well, like a lot of small businesses, the startup is the hard part. So finding the financing and worrying about the time crunch is the hard part. And Shoebox was really an integral part for us in getting this off the ground quickly and being able to do so affordably that we didn't have to worry about all that financing coming through. And it allowed us to open our doors much earlier than we had expected.
Well, I'm glad it was easy for you at New Hope Hearing Solutions to get the door open. And can you tell us a little bit about how easy or difficult it was to implement the Shoebox solution within your office?
It was very easy, and I will tell you a little bit about why we chose Shoebox. It was an affordable solution, and it was very quick and easy to get. And in doing that, we were able to provide the services fast for the patients, open the doors, and also be someone in the area that has something new, something different than what everybody else does here.
So Dr. Blair, can you tell me a little bit about the workflow that you've adopted using Shoebox?
Well, the tablet-based audiometry allows my hearing care coordinator to come and input all the demographics into the tablet before the patient arrives. I provide the testing, and then we use the tablet as part of our consultation to talk to the patient about the results. And then we use that, putting it into our office management system, which keeps everything paperless. So we absolutely love that.
And can you tell me a little bit about how this new workflow has benefited the patients?
Well, we definitely find that the testing, people are really receptive to this open audiometry idea that we've sort of coined this as. Nobody likes the soundproof booth. It's something people are used to when they've had a lot of hearing tests, but nobody actually likes going in there. So people are really receptive to that and enjoying the fact that they get to sit in an open room and have their testing done. Testing is quick, it's easy. And we also, as a clinic, love that it's a cloud-based data management system that is HIPAA compliant. So as a very small business and a new business, we don't have to worry about having and maintaining our own servers.
I'm glad that it eliminates, an extra barrier for you. And can you tell me a little bit about your experience once you got started with Shoebox? So did it help you overcome any operational inefficiencies?
Well, the main operational inefficiency it helped us overcome was getting opened up and getting testing started. So the fact that we could get it here so quickly and that we didn't have to have a freight and installation and everything for a booth allowed us to get it going. So that was a huge deal. Also, we thought in the beginning this was really just going to be a quick, affordable, probably temporary solution for our practice. But the more I've used it, the more I'm in love with it. So we've already decided for now that we're going to keep using Shoebox instead of traditional audiometry.
Well, I'm so glad that Shoebox has gone from something that you thought was initially a temporary solution to get the doors open to something you're going to keep long term. Was Shoebox met with any resistance initially?
Yeah, from me. I read about it. I thought, oh, how cool. That's gimmicky, or, that's not going to be something that is valid. The more I researched it and read the studies about it, the more impressed I was. And so when we decided to use it, I was, it was a very, very good option for us. But definitely the optics of the situation were concerned to me at first, and also for our consultant, who basically said the same thing. What about the optics? What about the optics? So we have taken that concern or that reticence about it and actually flip that to a positive and using this to set us apart from other practices. And we kind of coined the term open audiometry, like open MRIs, to market that. And so people know it's different.
I absolutely love open audiometry. And thank you so much for New Hope Hearing Solutions for bringing that term to Shoebox. We love it. So how has Shoebox helped you achieve your business goals? And are there any specific metrics that you can share with us, Dr. Blair?
Well, we're relatively new, but as far as what I can share as far as metrics, the fact that we estimate we were able to open our practice and start seeing patients approximately 2 months earlier than what we had expected, which saved us probably $15,000 in overhead expenses while an empty clinic was sitting here. The other thing is just the fact that we didn't purchase a booth and traditional audiometer. We estimate that saved us about $40,000 as far as startup costs.
And do you have any other use cases that you can think of when it comes to the Shoebox solution?
Yeah, as we've gotten started and gotten our feet under us, we have thought about some ways we could use Shoebox. It is a very flexible, the tablet-based audiometry is flexible. And so as a rural community, we think it will allow us to possibly use that in satellites or even in partnerships with other primary care groups that are nearby, or to provide testing in our community at assisted living facilities, when we go to health fairs and things like that. So in looking at future expansions, we could even utilize Shoebox for something like hearing conservation programs. And so telehealth is another big thing right now, and we think Shoebox would be a great tool to use in that as well.
That's awesome. Lots of use cases, which is always great to hear. And is there any other commentary that you'd like to add or share with us today?
I would just say, as a clinician, to using equipment, and that was one of the funny things my husband said was, aren't you going to figure out how to use that thing? And I said, no, I'll figure it out. That's like the last thing on my list of being concerned with. But I just can't express enough how easy it was and how efficient it is in our practice. We love the flexibility. We loved how affordable it was, how accessible it was. And, starting a new practice, especially in this day and age, was a leap of faith. And so I just think that it's fun to have started this and using something new and innovative like Shoebox.
That's great. Thank you so much, Dr. Blair. It was great speaking with you today, and we're really glad that you took the leap of faith with Shoebox.
Thanks.